Welcome to the Let Me Be Free podcast. My name is Jackie.
And my name is Alwyn.
We're two sisters from Ireland living in Australia, navigating our healing journeys together. And this is our podcast, Let Me Be Free. On the podcast today, I'm going to talk about what to expect when you see a therapist for the first time. Now, the first time you go to see a therapist, whether it's a counsellor, a psychologist, or a psychotherapist, the first few sessions are generally going to be spent actually just updating the therapist on where you're at, what's going on. Sometimes the therapist will have you fill out in a questionnaire beforehand, and it might have some details like your date of birth, an emergency contact. There might be a questionnaire about what current mental health issues you have or medications or stuff like that. But then when you get into the actual session, generally it's about an hour long. And to be honest, generally the first few sessions are spent just updating the person on what it is that's going on. So, for example, they'll want to know why is it that you're seeking counselling or treatment, so that you can explain what are the difficulties or challenges that you are currently facing. How does it affect your life? So that's really important. Like for me, I'd be saying, well, I have nightmares most nights. And it's important for me to explain how that affects my life, because sometimes, nightmares don't affect my life. I can have nightmares and get up the next day and be fine. But then other times when it's really bad, like it can make it so I can't focus during the day. I'm very irritable. I can lose my temper quickly with people around me. It can, when it's really bad, sometimes I can't even go to work. So it's important to explain what's going on, but also just as important to explain how that affects your life. Like, for example, if you're not sleeping, how does that affect your life? And then what you hope to achieve from the therapy. So for me, I want to see a reduction in my nightmares. And for somebody else, it might be, I want to see an improvement in my sleeping or whatever it is. They'll want to know about your background and life circumstances. So you might want to share some details about your childhood, your education, relationships, living situation, career. This kind of helps the psychologist understand you a bit better and tailor their approach to your needs. Any past treatment that you might have sought. So you can mention if you've seen another psychologist or mental health professional before, what type of therapy you received. Did any of that therapy work for you? Did it not work for you? Like, what did you find good about it? What did you find not so good about it? So for example, I've gone to different therapists and realized that some of the therapy that they do is more so on surface therapy. So it's more so about like dealing with things that are happening right now rather than getting deep into childhood trauma and healing that. So there's different types of therapy. Some things are more surface level and some things are deeper. And so now I always make sure that I'm clear with my therapist that I want to go deep, because that might not be the style of therapy that they like to do. And then the last thing that you can talk about is your goals for the therapy. So you can just express what it is you want to get out of it, what changes you would like to see in yourself and your situation, and how you would measure that. So for example, in my case, if I want to see a reduction in nightmares, I need to have an idea of how many nightmares I have right now. And then I want to set a goal like, do I want, rather than having nightmares every second or third night, I want to have maybe one nightmare every 2 weeks by, 6-12 months in, whatever I want to make it. Or if it's to do with sleeping, I want to be sleeping better by 3 months or whatever it is, but that really needs to come from you. Now, I personally find it absolutely exhausting to not only go to these first sessions with therapists and try to tell them everything. I find it so exhausting, but also it's so hard to remember all the information. So what I actually do now is I've just bullet pointed a load of information Because if I'm going to a few different therapists to see which one suits me, to see which one fits me, I don't want to waste lots of time talking about everything for 2 or 3 sessions. I want in the first session to get all the information out there to know if it's going to work or not. And also just because therapy costs money and I don't want to waste any money on explaining my circumstances. So I actually have a 2-page thing where I just listed out what's going on, what my previous history is, a bit about my current circumstances, etc., etc. And sometimes I just email that to the therapist beforehand. So I'm kind of like, if this isn't something that you can work with, let's not waste our time. Here's a rundown of everything. But at the very least, I take that to the first session. I just say to the therapist, look, if you don't mind, I'm just going to give you this printout of everything because you can read this in 5 minutes, whereas to actually communicate this information to you will probably take us 3 sessions. So it's up to you how you want to do it. But for me, I'm just always thinking, what is the best way and quickest way that I can get this done? Because sometimes you might need to go to 3 or 4 therapists before you find the right one. And that's a lot of money and a lot of your time and energy. And yeah, so that's my personal tip for going to a therapist. Thanks so much for tuning in today, guys. If you haven't done so already, please join our Facebook group, Let Me Be Free, The Wounded Inner Child, and post either anonymously or not what's going on for you in your world. We'd also be delighted if you would share this podcast or the Facebook group with one person who you think would benefit from the information. Be alone, Mahaguf. Have a beautiful day.